coaching.com, and today I'm going to talk to you a little bit about the emergency nursing and some of the insights and give you guys some tips. For those of you that know me, you know that I am an ER junkie. I love emergency nursing. It is my true love in nursing. Um, I like all aspects of nursing, but I have to tell you, I'd be lying if I didn't say that I get a little bit of high off the ER. No, I don't sit at home and wish for people to get hurt or anything like that, but it's what I really truly love about nursing is being able to care for anybody that comes through the ER. It's always a variety. I never get bored, and if anybody knows me, they know that I like to keep busy, and I probably have a little bit of adult ADHD, so keeping busy in the ER is really my forte. It's helped me with my priority skills. I can prioritize like no other. I love the teamwork that goes on in the ER, and I gotta give it to them that you have to be really flexible. So it's made me a little bit flexible in my other aspects of my life, as well as you have to have a really good sense of humor in the ER. Some things can really happen in the ER that are not always happy, and you have to be able to lighten up a little bit and be able to laugh just a little bit. So today I'm going to share with you kind of the reasons why you'd want to come to the ER and some things that don't warrant an ER and maybe just a clinical visit. Then I'm going to give you some tips on some common emergency things that happen and what you can do as you're on your way to the ER, or you've already called 911 that can help while you're waiting for people to come help you. And I'm also going to give you a tip on the things that are important to bring with you when you come to the ER. So things that definitely warrant you to come to the ER, but I'm going to insert a disclaimer here. I'm not telling you that you can't ever present to the ER. Please don't think that at all. At any time you think you need to go to the ER, then you need to go to the ER. I'm just kind of giving you some insight of things that warrant it and maybe things that you can just be seen at your local clinic for. So one of the top things that you need to become seen in the ER for is chest pain. Doesn't matter if it's sudden onset or if you've had it for 3 or 4 days. But I'm telling you, if you've had chest pain for 3 or 4 days, you probably should go see your doctor. Any kind of chest pain warrants an investigation, warrants to see what's going on. So you need to go be seen. If it happens to be during the day and you could be seen in the clinic, great. But I'm telling you, you should just go straight to the ER with any kind of chest pain. Any unexplained abdominal pain. Remember, other than our heart and our lungs, which are pretty close to our abdominal cavity, all of our major organs are in our abdominal cavity. So if you have sudden onset abdominal pain, you probably should be seen in the ER. Shortness of breath or wheezing. If you all of a sudden become shortness of breath and you can't catch your breath and you can't breathe, go to the ER, or with any of these, call 911. All your 911 personnel is excellently trained and deserve, know what they're doing, so call them. Throwing up blood or having bowel movements with blood in them. You guys, if those are sudden onset, they deserve to be seen by the ER. Something's going on that's not okay and you need to be seen. A high fever that can't be controlled with medication. And when you come into the ER and you present with like 103 temp and I ask you, what have you taken to help this, and you say nothing, that's not a high fever that's being controlled. If you can control it with medicine, a fever is usually an indication that your body is fighting an infection, and a fever is not necessarily a bad thing, but if it can't be controlled with medications, then you need to be seen. Vaginal bleeding, if you are pregnant, that warrants an instant trip to the ER. You need to be seen immediately. If you have a severe head injury or eye injury, you need to be coming to the ER. If you have an allergic reaction, or if you're unconscious, and I hope if you're unconscious at that point, somebody's called 911 to help you. And those are just some of the things, or like the top, what I think is the top priority to be seen in the ER. Things that I think don't warrant an ER visit, or that you can probably call your local clinic or go be seen at urgent care, is a low fever or cold symptoms. I'm not going to be able to help you out if you come to me to the ER with common cold symptoms or a low-grade fever. You can call me and I can give you suggestions, and I can get some suggestions for the doctor. But a common cold does not warrant an emergency, and it doesn't warrant an ER visit. A local ear infection, a simple insect bite, or seasonal allergies. Just think about it this way. If you When you come to the ER, I'm going to ask you, when did your symptoms start? How long have you had them? And what made them change for you to present at the ER at this point? I'm not asking those questions to be mean. I just need to gather that information so that I am able to give the doctor a report so that he can kind of get ahead of the game before he comes to the ER. If it is a common cold or a scratch versus a major cut, those things just don't warrant the ER, and you can by all means be seen in your local clinic, which in the long run, you guys, is cheaper for you to be seen in the local clinic than it is for an ER visit. I also want to share with you guys some quick tips on common emergencies. In any emergency situation, the first thing that you should do, especially if it warrants it, is call 911. If you're especially by yourself and you're having anything, don't try to drive yourself to the hospital, because you're not only putting yourself in danger, but you're also putting all the other patrons on the road in danger. So the first one that I'm going to talk about that's pretty common is cuts. If you get a major cut, I'm not talking about a cat scratch or anything like that, but if you get a major cut, if you're able to, you need to immediately wash it out with soap and water to help prevent infection. You want to wrap it and apply pressure, and if you're able to, elevate that above your heart. That helps stop the blood flow. Immediately come see your physician in the ER at the clinic, and do not attempt to suture it yourself, and do not attempt to super gluing it, because you guys, it has to be properly cleaned, and if it's not, you risk getting a really bad infection. So the next time that you think you're going to try to suture something yourself, and I know that it happens, or you're going to super glue it because you feel that's when it needs to be done, please don't, because you end up causing yourself an infection and end up having to see the doctor anyway. Another common emergency is an allergic reaction. And if it is severe enough, you guys need to call 911. I always keep Benadryl around. That is one of the first things that you can give somebody when they have an allergic reaction. And even on the outside of the bottle, I have the dosages for all ages and the instructions readily available. If possible, if you know somebody's having an allergic reaction, give them that Benadryl right away. Call 911 or get them to the clinic or the hospital right away. Number 3 for me is falls. If somebody falls, my biggest advice to you guys, don't try to move them. Call 911. These guys are specially trained to package these guys so that they don't receive any more injuries. If somebody falls, there's a chance they could have a spinal injury or a neck injury, and moving them can only make it worse. So let the people that are trained to do it, and get them to the hospital. Number 4 for me is ingestions of medications or poisonous. You guys, again, I'm going to stress the importance of having the poison control number on your refrigerator to call if that happens. You need to call them immediately. You also need to call your hospital. You need to call 911 or get them there as quickly as possible. But within any emergency you guys don't think you can handle, you really need to call your local ambulance. That's what they're there for. They are intensely trained and they know what they're doing, so let them do their jobs. Okay? In closing, when you guys come to the ER, I know one of the most annoying things from us nurses is that we ask for all this information. We ask for your medications, we ask for your allergies, we ask for your driver's license, and we ask for your insurance card. You guys, we're not asking for that information to be annoying. We're not asking for that to be a pain in your butt. It's just information that we need to be able to do our jobs to the best of our ability. So if you don't have that information, it's not a big deal. We can get it from you, but it just helps us do our job better. So remember, when you're in the ER and the nurse is asking you all kinds of questions, she's going to ask you your symptoms, when they started, what medications you're taking, the allergies that you have. I mean, there's going to be a list of questions that we ask. Answer them to the best of your ability, because what we're trying to do is give you the best possible care that we possibly can. We're not trying to annoy you. We're not trying to make you angry. We're just trying to do your job. And in the next time that you're in the ER, think twice before you get crabby with that ER nurse, because I promise you, she's just, again, trying to do your job. Again, as I always say, the next time you see a nurse, thank her, because she is just doing her job. You guys have a great afternoon, and we'll talk to you soon.